Good afternoon, one and all. I am Pravina Rela, Research Scholar, Department of ECE, JNTUA, Anantapura. I am the author of the paper titled Liver Tumor Segmentation and Classification, a Systematic Review. My co-authors are Dr. S. Nagaraj Rao, Professor, G. Pulla Reddy Engineering College, Kurnool; Dr. P. Ramana Reddy Sir, Professor, JNTUA, Anantapur. Abstract. The major tissue in the abdomen of human body is the liver. It has complex structure. Primary liver cancer can be classified as hepatocellular carcinoma and cholangiocarcinoma. In these two liver cancers, hepatocellular carcinoma is the common type, and this is the reason for most common liver cancer causing deaths worldwide. Computed tomography is the maximum considerable used imaging method for identification and treatment of liver tumors. The tumor must be treated at early stage; if not, it is going to cause several complications. The traditional methods used for detection of tumor are time-consuming, give the error in detection, and these methods requires expert to analyze the tumor. Hence, automatic and integrated methods are required to use instead of traditional methods. Liver tumor segmentation from the CT image is very important to analyze the liver function, pathological and anatomical study of the liver. It is also important for diagnosis of disease. This paper discusses various methods for early detection of liver tumors and also discuss the merits and demerits of these methods. Introduction. Liver is hefty and weighty organ that present on the right side of belly. Color of the liver is reddish brown, weighs around 3 pounds. The liver has right and left lobes. The gallbladder, part of pancreas, intestine present under the liver. All these organs and liver are the responsible for digest, absorb and process the food. The main function of the liver is to clean the blood coming from the digestive tract before supplying blood to the rest of the body. Liver also purifies the chemicals and processes the drugs. Liver diseases are hepatitis, cirrhosis, hepatocellular carcinoma, hemochromatosis, etc. These diseases occur due to infection, and some of the diseases due to genetic problems, and some of the diseases occur due to excessive alcohol. Some diseases occur due to unknown reason. CT scan of abdomen is used to obtain a clear picture of liver and other organs. Liver cancer is the 10th most common cause of death in USA. If the cancers are detected and diagnosed early, then the survival rate increases. CT is important modality for detection of liver cancer. The accurate segmentation of liver tumor is very difficult and very important for treatment because its features such as shape, size, and location are differ among the persons as shown in the figure. General steps for liver tumor segmentation. So here we will be discussing what are the general steps to segment the liver tumor segmentation. The first step in this is CT liver imaging. The CT liver image can be obtained from the different data sets. We have public data sets such as IRCAD, 3D IRCADD, MICA, Silver 7 datasets. And CT liver image can also be obtained from the cancer treatment hospitals. The CT liver images should be given as the input to this system. The second step is image pre-processing. The pre-processing is important to decrease the noise exist and improve the edges of the CT liver to, to segment the liver and tumor effectively. There are different spatial filters to enhance the CT liver images. Those are Wiener filter, bilateral filter, hybrid filter, guided filter, curvature filter, thresholding, histogram equalization, etc. Next step is liver segmentation, and we have tumor segmentation. And these two steps are very important for tumor detection and classification. There are different segmentation methods used in the literature, such as morphological reconstruction by dilation, fuzzy seaming clustering using microscopic sets, fully conventional networks, fast 3D snake algorithm, fuzzy seaming clustering with level set, mean gray wolf optimization technique, watershed transform applied on gradient magnitude, etc. The next step is feature extraction. CT liver tumor image can be recognized by the features such as texture, shape, and size. The shape of the liver and gray level information of the liver is not sufficient to classify the liver. Hence, we use texture information is also required to segment to classify the liver properly. The features such as statistical features, mean standard deviation, skewness, and kurtosis, and second order statistical features, that is gray level co-occurrence matrix, and geometrical features that is area, perimeter, circularity, equivalent diameter, and roundness are extracted from the segmented region. Next step is classification. Based on the feature extraction, tumors are classified into different types. Classifiers such as SVM classifier, DNN classifiers are used for classification. Literature survey. Here we will discuss what are the different methods used for different steps in the tumor segmentation process. So in paper 23, we have seen that histogram and thresholding is used for pre-processing. Morphological reconstruction by dilation is used for liver segmentation. Watershed algorithm control where the marker is used for tumor segmentation. And here the input images are collected from the hospital at Algeria. And in the paper 24, median filter is used for pre-processing and NS and FCM is used for liver segmentation. In paper 25, fully conventional networks are used for liver segmentation and another network, fully conventional network is used for tumor segmentation. So here the input images are taken from LITS dataset. In paper 26, Wiener filter is used for pre-processing, fast greedy snake algorithm is used for liver segmentation and tumor segmentation, and neural network classifier is used for classification. Here, the input image is collected from different datasets, that is LITS dataset, MyKai dataset, and also from the local hospitals. In paper 27, histogram operation is also is used for pre-processing. FCM with the level set is used for liver segmentation and tumor segmentation. Here also they have used different data sets to verify their algorithm. And these are the other methods we have discussed in the literature. So, even though there are multiple classifiers for diagnosing liver tumor, still there are some defects with the existing models, so that new models need to be implemented for accurate segmentation and classification. Among these methods, whatever we have discussed in the literature, CNN is the has better performance, but it requires more capacity computers for to perform tumor segmentation using CNN. And FFCM and APS2 will also give accurate result. And when we are applying this algorithm on real-time data, it is not giving perfect results. FFCM is also gives accurate result, but for real-time data, it is not giving accurate results. And logistic regression, the fuzzy pixel classification is also having the problem when we are playing on large number of data. It is not accurate. And decision tree is also have improved performance, but it requires more training time. Like that, here we have discussed so many methods in the literature. These methods requires more training time, and these methods are a little bit slow. And this methods, some of the methods require um, large capacity computers. Some of the methods are complex, and some of the methods are not giving accurate results. So that is why we need to develop a algorithm which gives accurate segmentation of tumor. So here we will be discussing the method we are going to use for segmenting the tumor accurately. So in this method we are using region-based segmentation for region growing algorithm for segmenting the tumor. So in the region growing algorithm, we need to select a seed point to extract the tumor region. So seed point usually selected manually. So instead of selecting seed point manually, we'll be using FCM clustering method to select the tumor seed point automatically. And for classification, we have combined RNN and CNN methods. And here, the optimization of number of hidden neurons can be obtained by using bio-inspired algorithms. So that this method, with the less computational complexity and with less time, it gives accurate results. This is the proposed method. And the references are, these are the references. The second set of references, these are the references used. Thank you.